COVID and that are due to Omicron. So this is a great time to get vaccinated. It's a great time to get protected because you will not be able to hide from Omicron. Next slide. I did want to briefly just say a really nice report came out from the CDC recently about the safety in the 5 to 11-year-olds with vaccination. This was a summary that ended on, I think, around the 19th of December. There was only 11 cases of myocarditis out of 8 million doses given. None of those kids got sick. Those kids were not hospitalized, and the rates of myocarditis are so much higher with natural COVID infection that protecting your 5 to 11-year-olds has never been safer and is a great thing to do. The lower dose of the vaccine in those younger kids seems to be giving them the immune response they need without actually increasing risk. Next slide. I did want to briefly kind of touch on what is the CDC doing lately in terms of the changing in isolation and quarantining. You isolate when you're infected, you quarantine when you're exposed. So the isolation here, I'm not going to go through this in every detail here, but from day 0 is when your symptoms start, and then 5 days after. If you have mild infection, which is basically you have upper respiratory tract infection, if you have shortness of breath, if you're coughing, or if you have any abnormal imaging of your chest, you don't count it as a mild infection, and then you should isolate for the full 10 days. If you have a mild infection by this definition and you're improving significantly, then days from 6 to 10, you can leave that isolation, go out into the public, but you have to wear a mask the entire time, including when you're around loved ones and other people. This does not apply to people who have moderate illness, people who are immunocompromised, or people that are still symptomatic. I would actually say this is going to be very challenging for people who have no vaccine immunity because they are almost never feeling good at day 5. And so the infection tends to rise and continue from there on rather than get better in those individuals. Next slide. This is, again, a lot of information here, but really what's important, and we're going to send out these slides, and I think we're going to be sharing some of this information as well. But in terms of exposures and quarantining, this is also better than it was. If you are vaccinated and you're boosted, then you don't need to quarantine right now. You need to avoid travel. You need to be avoiding people who are high risk. So we're transitioning to a next stage in COVID where we are thinking about what is the worst thing that could happen if I'm positive and I'm around people that could get hurt. That is what we have to do now as we start preparing for some of these new therapeutics coming. The quarantine also, if you are not vaccinated or not fully boosted, then the quarantine has been shortened there. But again, you have to wear a well-fitted mask. And if everyone has also noticed the update in the Kent County Health Department public order that came out last night, there's very strict instructions to schools that they have to have kids who are exposed or kids who are positive still wearing a mask. And there's actually some very strong wording about universal mask mandates. And if they don't have some of those things in place, there are certain rules they have to follow from school-age kids. Next slide. There are a lot of new therapies, and I just want to put these up there saying that those 4 medicines on the left-hand side are treatments that we have for outpatient therapy. This is going to be our big key to getting out of the pandemic, because what this will allow us to do is effectively treat those who are immunocompromised, those who can't get vaccinated, and those who are at extremely high risk for COVID-19 adverse outcomes, to get effective therapies to keep them safe. At the same time, we are getting back to real life and can actually just live with COVID. So if I was just going to say that COVID is a cold, that's great. I'm not worried about isolating anymore. But the issue is right now, I can still hurt people around me that are susceptible or at risk. And these therapies on the left are going to be rolling out in greater quantities in the community very, very soon. And they will allow us to effectively quickly treat people. And Dr. Woods is going to talk in a minute about how important it is for you to plug in with your health system and your health family. Next slide. This is extremely important for our listeners and the media and our community to understand. The treatments are coming, but they're extremely limited. And right now, the oral antivirals and the IV monoclonal antibody that we have is only being used in the highest risk individuals because supply is so tight. So that is those who are age over 75 and not maximally vaccinated, or those at any age who are really severely immunocompromised, regardless of vaccine status. That is the only people that we are allowed to give the oral Paxlovid to, and frankly, the oral or the IV Sotrovimab to. We are able to go to Tier 1B for the Molnupiravir, but these are big limitations, so it's important that you talk to your doctor. Next slide. This is simply being put up to recognize that the medications that we are using, you have to have a good relationship with your doctor. You can't just talk to a random Joe and have this prescribed. There are very significant drug interactions, and you really have to have a good relationship to make sure that you're safe and that you're effectively treated with COVID. These are the medications on the left that you cannot use Paxlovid with. It's an absolute contraindication, and they are very common medications for your heart, for your heart rhythm, for blood thinner medications. There are also some antibiotics on there. It's a very, very big deal. So connecting with your doctor is essential. Next slide. So the message from the infectious disease doctor is this: I'm optimistic more than I've ever been before. I am less afraid of getting COVID than I've ever been before, but that's because I'm vaccinated and I'm boosted, and I am making sure I protect the people around me. So get vaccinated, get boosted, decrease your transmission, decrease the duration of symptoms, decrease long COVID risk, and protect those around you. Partner with your PCP, get plugged in where care is appropriate, and we are closer than ever to getting out of this. Thank you.
Thanks, Dr. Jamieson. And now, just to share a little bit more about the importance of having that strong primary care provider relationship, I want to introduce Dr. Woods, who's president of Mercy Health Physician Partners.
Thank you and welcome today. As you've heard, Mercy Health is here to partner with our community to help the health and wellness within our community. And as your partners, it's so important that we share information. So hence the town hall today, but also you can find the most up-to-date information on our website. And I just wanted to share that because there's a lot of information buried in this website, especially if you go to the COVID-19 portion, and that's on the slide at the top right in the blue. But the latest information, data, statistics that we've shared today, a lot of that is on this website. Where to get screened or tested for COVID, the directions are on here, how to schedule an online visit with your PCP or with to have a test done. You can do that from this website as well. Information on the vaccine and FAQs are embedded in here so you can stay knowledgeable and most up to date. And then also there's information on here about cancellations or hours and status of our clinics and labs, etc. So make sure you stay in tune with our website. But as your most trusted partner, next slide, Erin, we do want you to stay connected to your primary care physician as well. It's critical as your primary care physician and the team that supports that physician or provider, they want to have a lifelong partnership with you and your health. They're going to be very much active and involved in your independent care, your personalized care, but they can also help you with any concerns that you have about your general health as it pertains to COVID or just questions in general. And then you have the security and that convenience of having all of your healthcare needs coordinated by that single provider-led team that's there to look out for you. Next slide, please. Having said that, I also want to acknowledge some of the challenges that you may have experienced in the community trying to reach your primary care provider. Dr. Bierzak did a nice job going through the impact of the pandemic and the impact that we've had on the healthcare system. And our primary care and specialty offices are no different. We've been shifting resources to support the hospital, We've been shifting resources between practices to support one another. And I want to make it clear that we are not shutting down. Early in the pandemic, we did, as we were just scrambling to understand the pandemic and how to best keep you and our team safe. But we've figured that out now, and we have very safe practices. So we're not shutting down as long as we have enough staff to man the practices, and then we'll coordinate and shift as needed. If nothing else, we have learned to be adaptable. Our phone volume has gone up a substantial amount, and in this recent surge, we're up over 30% higher than normal calls. So please be patient with us if it takes longer to get to your call. And remember that website. That's a great source to get many of the common questions answered. We've also had to prioritize access. So you may find that some of your visits get canceled or pushed out if they're of a less urgent nature. And if you feel differently, then please communicate through the portal or phones to your provider on why you need to be seen sooner. Again, we're here to partner with you. Next slide, please. And this is just a quick comment on the staffing challenges that many of you are aware of because you're seeing it in your own businesses as well. But we have almost 3 times the number of open positions at this time. Layering on top of that any absences, which is over 20% in the last couple weeks for us, largely due to COVID exposures, quarantines, or isolations. So again, this is just letting you know that we're working through these challenges. And next slide, it's a plea to you in the community to partner with us. As it's already been mentioned, consult our website for questions if that can help reduce phone volumes, but also help us keep our colleagues and the staff that care for you safe by masking, washing and sanitizing your hands, socially distancing, getting vaccinated and boosted, and then encouraging those around you to do the same. Thank you, and I'll turn it back to Dr. Bierzak for questions.
Thanks, Dr. Woods. We're nearing the end of our time, but there's a couple questions that were submitted by some key community members and partners that we put out ahead of time that I'd like to address. One is probably the most common question that I'm hearing nowadays, and I'd like to address this to Dr. Jamieson. And that's, you know, a number of people now, we're starting to see the impact of influenza. We're starting to see folks get the cold in addition to COVID. There's a lot of overlap in symptoms. I'm just wondering if you could speak to some of these differences and what should trigger someone to get tested for COVID-19.
Yeah, I think the first thing is your trigger should be how much can you afford to be wrong? So if you're going to visit grandma this weekend, you need to get tested right now. If you are young and healthy and living with other young, healthy, vaccinated individuals, you might be able to play a little bit more and see what your symptoms do. One of the biggest differences between typical infections with influenza or regular viruses is the timeline. So influenza tends to make you feel really bad at the very beginning and then slowly taper off after kind of day 1 peaks, and then it starts getting better. COVID still builds, so you get really subtle symptoms, and all of a sudden on day 4 or 5, you're like, oh man, that sore throat, that sniffle, now I'm kind of coughing a little bit more. That would be very unusual for respiratory viruses or COVID, or for influenza. So the timeline helps a lot. A lot of times, if you can't afford to get other people sick, or you can't afford to be around others that are sick, and you do have very subtle symptoms right now, I would encourage you to get tested early. Additionally, if you are someone with medical illnesses or someone who's immunosuppressed, getting tested early will let you plug into the healthcare system and with your primary care partner very quickly, so that if you are eligible for our monoclonal antibody or our antiviral therapies, we can make that happen very soon. Those timelines are 5 days or less of symptoms for the oral antivirals. So testing early is huge, and I would really encourage people to do that.
Thanks a lot, Dr. Jamieson. I appreciate that answer to a very common question. I'm sorry that we haven't been able to address any other questions because we're nearing the end of our time. You know, we will ensure, as Amy wrote within the text, you know, that we can address some of the specific questions that media might have. I really want to thank our panelists Dr. Woods, appreciate the conversation around the primary care impact and the need for a primary care physician relationship. Kari, very much appreciate the support and the messaging from the faith community in this important time. And Dr. Jameson, always appreciate your expertise related to COVID. Thanks all for joining us, helping us keep us informed, and the importance and for sharing the importance of continuing to follow the public health guidelines and the guidance that we've outlined today. So please be safe, please be well, and appreciate you joining us.
Thank you.